201. A patient is diagnosed with hepatitis B. Which infection control practice is necessary for all healthcare providers? Answer: use standard precautions and ensure proper disposal of contaminated materials. Explanation: hepatitis B is transmitted through blood and body fluids, and standard precautions, including proper disposal of contaminated materials, are necessary to prevent transmission. 202. A nurse observes a visitor who is not wearing a mask while visiting a patient on airborne precautions. What should the nurse do? Answer: inform the visitor about the importance of wearing a mask and provide the appropriate PPE. Explanation: airborne precautions prevent the transmission of pathogens, and ensuring visitors wear appropriate PPE is crucial for maintaining infection control. 203. What infection control precaution should a nurse take when caring for a patient with Clostridium difficile, C. difficile, diarrhea? Answer: perform hand hygiene with soap and water and wear gloves and gown. Explanation: C. difficile spores can survive on surfaces and are resistant to alcohol-based hand sanitizers, so thorough hand washing with soap and water is necessary. 204. A patient requires a dressing change for a surgical wound. What infection control practice should the nurse follow? Answer: use sterile gloves and maintain a sterile field when performing the dressing change. Explanation: sterile technique prevents introducing pathogens into the wound and reduces the risk of infection. 205. A nurse is caring for a patient with a draining abscess. What infection control precaution should be implemented? Answer: implement contact precautions and wear gloves and a gown during patient care. Explanation: abscesses contain infected material, and contact precautions with appropriate PPE help prevent the spread of infection. 206. What is the nurse's role in preventing healthcare-associated infections, HAIs? Answer: follow infection control protocols, including hand hygiene, and educate patients and staff about proper infection prevention techniques. Explanation: prevention of HAIs relies on consistent adherence to infection control protocols, including education and hand hygiene. 207. What should a nurse do if a patient in isolation requests to leave their room for an appointment? Answer: ensure the patient wears appropriate PPE and arrange for safe transportation. Explanation: when patients in isolation need to leave their rooms, wearing proper PPE minimizes the risk of spreading infection to other areas. 208. How should a nurse clean hands after providing care to a patient with MRSA? Answer: wash hands thoroughly with soap and water. Explanation: MRSA can be spread through contact, and washing hands with soap and water effectively removes bacteria from the hands. 209. A patient on droplet precautions needs to undergo a procedure in the operating room. What should be the nurse's priority action? Answer: ensure the patient wears a surgical mask during transport and while outside their room. Explanation: droplet precautions require a surgical mask to prevent the transmission of respiratory droplets. 210. A nurse is assisting a patient with a urinary catheter in place. What is the most important infection control measure? Answer: perform hand hygiene before and after handling the catheter and use aseptic technique. Explanation: hand hygiene and aseptic technique reduce the risk of introducing pathogens into the urinary tract, preventing catheter-associated urinary tract infections, CAUTIs. 211. A nurse is caring for a patient with a compromised immune system. Which infection control measure is most important? Answer: minimize exposure to individuals with respiratory infections and practice strict hand hygiene. Explanation: immunocompromised patients are at higher risk for infections, so minimizing exposure to ill individuals and ensuring thorough hand hygiene are critical. 212. What should a nurse do when disposing of contaminated items from a patient with a gastrointestinal infection? Answer: place the contaminated items in a designated biohazard bag for proper disposal. Explanation: contaminated items should be disposed of in biohazard bags to prevent the spread of infectious material to other areas. 213. What personal protective equipment should a nurse wear when caring for a patient with chickenpox? Answer: wear an N95 respirator, gloves, and gown. Explanation: chickenpox is transmitted via airborne droplets, and an N95 respirator, along with gloves and a gown, are necessary for protection. 214. A nurse is providing care for a patient diagnosed with pertussis. What infection control practice is needed? Answer. Implement droplet precautions, including the use of a surgical mask for the nurse and the patient. Explanation. Pertussis is spread through respiratory droplets, and droplet precautions help prevent transmission. 215. What is the priority infection control practice when caring for a patient on reverse isolation? Answer. Limit visitors and ensure that healthcare workers are free of any infectious conditions. Explanation. Reverse isolation is used to protect immunocompromised patients, so minimizing potential exposure to infection is essential. 216. A patient who is post-surgical is exhibiting signs of a wound infection. What is the priority infection control action? Answer. Clean the wound with an antiseptic solution, apply a sterile dressing, and perform hand hygiene. Explanation. Cleaning the wound reduces the risk of further contamination, and using a sterile dressing helps protect the wound from outside pathogens. 217. What action should be taken when a nurse notices a patient's personal belongings are contaminated with body fluids? Answer. Place the contaminated belongings in a biohazard bag for proper disposal or cleaning. Explanation. Contaminated belongings should be contained to prevent the spread of infectious material and cleaned or disposed of accordingly. 218. What is the most effective method for preventing the transmission of infectious diseases in a hospital setting? Answer. Adhering to standard precautions and practicing good hand hygiene. Explanation. Standard precautions, including hand hygiene, reduce the transmission of most pathogens and are the most effective infection control method. 219. What should a nurse do when cleaning a surface that has been contaminated with blood and body fluids from a patient in isolation? Answer. Clean the surface using an EPA-approved disinfectant. Explanation. An EPA-approved disinfectant is effective in killing pathogens, ensuring that surfaces are properly sanitized and preventing cross-contamination. 220. What is the most important infection control measure when caring for a patient with a draining wound and suspected MRSA? Answer. Implement contact precautions, including wearing gloves and gown. Explanation. MRSA is spread through contact, and contact precautions are necessary to prevent the infection from spreading to other patients or healthcare providers. 221. How should a nurse dispose of a contaminated needle after giving an injection to a patient in isolation? Answer. Place the needle in a puncture-resistant, labeled sharps container. Explanation. Proper disposal of needles in a puncture-resistant container prevents needle stick injuries and contamination. 222. What is the most appropriate action when a nurse encounters a visitor who has not followed isolation precautions? Answer. Educate the visitor about the importance of following isolation precautions and provide the necessary PPE. Explanation. Visitors must follow infection control measures to prevent the spread of infection, and education ensures compliance with precautions. 223. A nurse is caring for a patient with a wound infection. What is the most important infection control measure during dressing changes? Answer. Use sterile gloves and maintain a sterile field during the dressing change. Explanation. Maintaining sterility during dressing changes reduces the risk of introducing new pathogens into the wound and prevents further infection. 224. What should a nurse do if a patient with an indwelling catheter develops signs of a urinary tract infection, UTI? Answer. Notify the healthcare provider and follow the appropriate protocols for catheter care. Explanation. Prompt identification and treatment of UTIs, including proper catheter care, prevent further complications and spread of infection. 225. When caring for a patient on isolation precautions, what is the nurse's responsibility? Answer. Adhere to the specific precautions required for the patient's condition and ensure the appropriate PPE is used. Explanation. Adhering to isolation precautions for the patient's specific condition is essential to prevent cross-contamination and protect healthcare workers. 226. What is the primary infection control practice when caring for a patient with Clostridium difficile, C. difficile, infection? Answer. Perform hand hygiene with soap and water, and wear gloves and gown. Explanation. C. difficile spores are resistant to alcohol-based hand sanitizers, so washing hands with soap and water is essential for effective hand hygiene. 227. How should the nurse respond if a patient in isolation requires emergency care? Answer. Ensure that appropriate PPE is worn and limit the patient's exposure to others. Explanation. Wearing the correct PPE and limiting exposure ensures that the infection does not spread to others in the emergency setting. 228. What infection control measures are necessary for a patient diagnosed with viral meningitis? Answer. Implement droplet precautions and ensure that the patient wears a mask if they need to leave their room. Explanation. Viral meningitis can be transmitted through respiratory droplets, requiring droplet precautions to prevent its spread. 229. What action should the nurse take when caring for a patient who is undergoing chemotherapy and has a low white blood cell count? Answer. Implement reverse isolation precautions to protect the patient from infection. Explanation. Reverse isolation is crucial for patients with low white blood cell counts, as it protects them from exposure to pathogens. 230. What is the nurse's role in preventing the spread of infections during a patient's discharge? Answer. Provide discharge instructions regarding infection control measures, including wound care and follow-up appointments. Explanation. Proper discharge instructions ensure that the patient continues infection control practices at home and reduces the risk of reinfection or spreading the infection. 231. When a nurse is caring for a patient with a surgical wound, what is the best way to prevent infection during dressing changes? Answer. Use sterile technique when changing the dressing. Explanation. Sterile technique prevents contamination of the wound and reduces the risk of infection during dressing changes. 232. What is the most important infection control measure when caring for a patient on contact precautions for scabies? Answer. Wear gloves and a gown, and avoid sharing personal items between patients. Explanation. Scabies is transmitted through direct contact, and proper PPE and hygiene help prevent the spread of the infection. 233. A nurse is caring for a patient with tuberculosis, TB. What is the most important infection control practice? Answer. Place the patient in a negative pressure room and ensure the nurse wears an N95 respirator. Explanation. TB is airborne, so a negative pressure room and the use of an N95 respirator are necessary to prevent transmission. 234. What is the most effective way to prevent the spread of methicillin-resistant Staphylococcus aureus, MRSA? Answer. Implement contact precautions and practice thorough hand hygiene. Explanation. Contact precautions and proper hand hygiene are critical in preventing the spread of MRSA in healthcare settings. 235. A patient with an open wound is admitted to the hospital. What infection control measure should the nurse prioritize? Answer. Use sterile technique when performing any procedure involving the wound. Explanation. Sterile technique minimizes the risk of introducing pathogens into the wound, preventing infection. 236. When caring for a patient with a respiratory infection, what infection control measure should the nurse implement? Answer. Use a surgical mask on the patient and wear personal protective equipment, PPE. Explanation. Wearing a surgical mask and PPE helps prevent the spread of respiratory infections to others. 237. What should a nurse do if a patient's personal items are soiled with fecal matter? Answer. Place the soiled items in a designated laundry bag and follow infection control protocols. Explanation. Proper containment of contaminated items prevents the spread of infection to other areas. 238. How should the nurse dispose of contaminated personal protective equipment, PPE, after use? Answer. Dispose of used PPE in the appropriate biohazard waste container. Explanation. Proper disposal of PPE in biohazard waste containers prevents contamination of the environment and protects others from exposure. 239. What is the nurse's priority action when caring for a patient with a suspected viral hemorrhagic fever, VHF? Answer. Implement strict isolation precautions, including contact and droplet precautions. Explanation. VHF is highly contagious and can be transmitted by direct contact with body fluids, so strict isolation precautions are necessary. 240. What is the priority intervention for a patient with an indwelling central line? Answer. Implement a septic technique when caring for the line and perform frequent assessments. Explanation. Aseptic technique prevents infection at the insertion site and reduces the risk of central line-associated bloodstream infections, CLABSI. 241. What is the most important step in preventing catheter-associated urinary tract infections, CAUTI? Answer. Perform proper hand hygiene before and after handling the catheter. Explanation. Hand hygiene is essential to prevent the transfer of pathogens and reduce the risk of CAUTIs. 242. When caring for a patient with Clostridium difficile (C. diff) infection, which precautions should be implemented? Answer. Use contact precautions and ensure thorough cleaning of the environment. Explanation. C. diff is spread through direct contact, so contact precautions and thorough cleaning are crucial to prevent transmission. 243. What should a nurse do if a patient develops an infection after surgery? Answer. Notify the healthcare provider and follow infection control protocols for wound care. Explanation. Promptly notifying the healthcare provider allows for timely intervention, and following infection control protocols ensures proper wound management. 244. What is the most important practice when administering injections to prevent infection? Answer. Use a new, sterile needle and syringe for each injection. Explanation. Using sterile equipment prevents the introduction of pathogens into the body, reducing the risk of infection. 245. What action should the nurse take if a patient's incision shows signs of infection? Answer. Assess the wound, document findings, and report to the healthcare provider. Explanation. Early identification of infection allows for timely treatment and helps prevent complications. 246. What infection control measure is necessary when handling blood or body fluids? Answer. Always wear appropriate personal protective equipment, PPE. Explanation. PPE protects the nurse from potential exposure to infectious materials and helps prevent the spread of infection. 247. What is the most effective way to prevent surgical site infections? Answer. Administer prophylactic antibiotics as ordered and use sterile technique during surgery. Explanation. Prophylactic antibiotics and sterile technique are essential in preventing infections during surgery. 248. What should the nurse do if a patient has a positive culture for a resistant organism, such as vancomycin-resistant enterococci, VRE? Answer. Implement contact precautions and inform the healthcare team of the infection. Explanation. Contact precautions are necessary to prevent the spread of resistant organisms, and informing the healthcare team ensures appropriate management. 249. How should the nurse handle a patient who is immunocompromised and has a fever? Answer. Immediately assess for signs of infection and notify the healthcare provider. Explanation. Immunocompromised patients are at higher risk for infection, and prompt assessment and reporting ensure timely intervention. 250. What is the most important infection control measure when caring for a patient with a draining wound? Answer. Use sterile technique and wear gloves when handling the wound. Explanation. Sterile technique and gloves help prevent the introduction of pathogens and reduce the risk of infection.